Chen joins me to discuss China's role in global efforts to combat the coronavirus. He's an associate professor of health policy and economics at the Yale School of Public Health. Great to see you again.
Thanks for having me, Elaine.
Well, we see that the Chinese-made vaccines are rolling out to more countries around the world this week. There's been a lot of the vaccine unloaded, especially in many parts of Latin America and Africa. And it seems that China is exporting more vaccine than administering in its own country. But we're seeing that not every country is doing this.
Yeah, indeed. So the big background is that there's a large uneven distribution of vaccines so far, and most of the vaccines have been locked up by developed countries. So there's a large demand from developing countries, which are usually hit hard, especially hard by this pandemic, and vaccination can help revive the economy and restore the confidence of the populations. So, and also we know that much of the clinical trial test sites are in South American, in African countries, and those countries are facing tightening infections, especially when they are closer to their winter time for the southern hemisphere. So they really need to rush to reach the herd immunity before they get into the winter by June. And the developing world suffer from the shortages and in order to reduce the replication of the virus, to reduce the variants, the types of variant coming out, they have to do it very quickly. So the vaccine from China, especially the three are most promising. One is Sinopharm, the other Sinovac, and also the third one, which is very new, which is called CanSino Bio. And they all have their own advantages in order to face the context in developing world. For example, they do not need extremely low temperature in their storage and transportation, and they also, although their efficacy rate is slightly lower than the Western vaccines, but they are very effective in preventing those severe disease. And we know that.
Let me stop you right there, because I want to ask you about the efficacy of these Chinese-made vaccines. A lot has been made about that. There is some talk that some of these vaccines that go into countries with lower rates of coronavirus, does it matter that they have lower rates compared to higher rates here in the United States, and you do need higher efficacy rates with those vaccines like the Pfizer vaccine and the Moderna vaccine? Does it matter?
Yes, this is a good question, but there are actually two important parameters in determining the efficacy of a vaccine. One is how effective it is to prevent the transmissions and the infection. The other is the hesitancy or the willingness to be inoculated by the vaccines. For example, if in the Western countries there's too much hesitancy, then even if the vaccine is 100%, it still will be discounted because not many people will want to be vaccinated. So these two parameters has to both be met. So for example, in China's vaccine being exported to developing world, the hesitancy rate in the local population is usually lower. So that means they can complement or they can fill the gap of the lower efficacy. So that's why there's also a market there. And also, as I mentioned, the infrastructure and also the pricing and also the China's vaccine, the third vaccine, the CanSino Bio, which only need one dose, which is very similar to Johnson & Johnson. So this will remove some of the concern about logistics, since they do not need to track people's first dose and the second dose. That means the market will be larger, especially for countries with concern about their distribution system.
We have a little bit of time left, about a minute left. I want to ask you about the bigger picture here. You mentioned something interesting about the seasons across the world and trying to get everyone vaccinated in the southern hemisphere. So how important are these Chinese-made vaccines in the global effort against COVID-19? Some call this vaccine diplomacy.
vaccine diplomacy is this is also a term, but it will be important to fill the gap of the large shortage in vaccines. The number is shows that 16% of the countries now locked up around 75% of the vaccines. That means the majority of the world population are without vaccine. And many of them will be experiencing winter, the most harsh time when they are experiencing this pandemic. So it's really important to rush against the time to win the time to vaccinate as many people as possible. And we all in this pandemic together, even if we can reach the herd immunity for a certain country, but without other countries to reach the herd immunity, there will be a trouble because the new variant will come out, like the Brazil one, the South Africa one, and the UK one. So in order to reduce the concern about the new variants, it's very important to have a timely and equitable distributions through every corner of the world. That will be very important.
It's about getting the world back up and running again. Chen from the Yale School of Public Health, always great to see you. Thank you so much.
You bet.